Earlier this year, the state kicked more than 1 million Texans off of Medicaid without first checking if they were eligible for coverage. Thousands of them are still waiting to get those benefits restored. And the process can take months as workers face a big backlog of applications. But now some encouraging news. Investigator Matt Grant found the state's overtime push is beginning to unclog the backlog.
It's concerning at any time of the year. It's even more heartbreaking at the holidays.
Help still isn't coming fast enough. That's according to a new report from a coalition of children advocates and nonprofits, including Every Texan. Stacy Pogue is a policy analyst.
So people are making really hard choices right now about what do they spend on Christmas gifts? Do they fix their car? How are they going to pay rent if what they need to do is pay for healthcare or food?
Since pandemic-era Medicaid protections ended in April, the report found Texas only processed 3% of data-based automatic renewals. That's the lowest rate in the country. Last month, 39% of Medicaid applications took longer than the 45-day federal requirement to be processed, and 1.1 million Texans were dropped due to procedural problems.
There were some errors in the computer programming in the system for eligibility that was kicking folks off when they shouldn't be.
The study also highlights our reporting, which found last month 150,000 people were waiting longer than 45 days, and points to new data showing more than 48,000 Medicaid applications have been sitting untouched since March. To tackle the backlog, the Texas Health and Human Services Commission is encouraging employees to work overtime this month and increasing training. Those efforts appear to be working. Officials report the average time it takes to process an application dropped this month from 120 days to 36. HHSC spent more than $5.5 million in overtime in September and October, and more than $27 million since last year. Officials say they were approved to hire more than 600 full-time staff and say they're moving aggressively to reduce the backlog and implement new strategies, not just with Medicaid, but also federal food benefits. Matt Grant, State of Texas.
Whistleblowers within the Texas Health and Human Services Commission have pushed the state and federal leaders to take action to reduce the backlogs. In September, we told you how they sent a letter to the governor highlighting issues within the system with staffing and leadership. Congressman Lloyd Doggett, a Democrat from Austin, published the letter, and he and other lawmakers have called on federal regulators to intervene. Thank you again for joining us for State of Texas. I'm Monica Madden. We'll be back next week to bring you an in-depth look at Texas politics.